Hello, good morning everybody. Welcome once again to the Thursday tea. Hope we're excited because today we're going to be doing something I don't think we've ever done in this show before. Have you ever done what we're about to do?
I'm waiting for it. Tell me.
Okay, we are going to tell us anyway.
Yes.
So welcome once again. Let me introduce myself. I'm Jennifer Jinkoye and with me is
Pharmacist Adama.
Yes, our wonderful pharmacist Adama is here to put us through on everything that we need to know on this topic. So what exactly is this topic? We're going to be talking about malaria in pediatrics. Now before you begin to wonder what the word pediatrics means, once you hear the word pediatrics, it just associates with children, especially healthcare as it concerns children. Okay, so let's put our tea in the hot water because I know that the water has stood for a while.
Okay. How do you do tea today?
Okay, so from Ada, I don't know why you rejected the flavor green tea. I would like to know why did you choose the
I don't have a reason. I just wanted to
Okay, you just feel like the green
Yes.
tea. It happens sometimes.
That one is cinnamon and
An
apple.
apple, yes. Actually like it though, I prefer the mint when I took it the other day, but it's fine. It's fine. Okay, so the big question, we're going to be talking about babies today. I don't think we've really talked about babies in our episode, but today we are really thinking deep about our infants and the fact that of course they could be exposed to some of the diseases that adults are exposed to as well, but what is the care for them? So that brings us to the tea talk question.
Yeah.
Do babies actually suffer malaria?
Yes, they do. Babies suffer from malaria. They are living things. Like they suffer from malaria.
Of course.
If you expose your child to mosquito bites, the child will definitely come with malaria.
Malaria,
Yes.
of course. Okay, that's a great one. So now we are clear that children actually suffer malaria because some people just feel that, oh, I don't even know. You know, some people actually don't really believe that a child can suffer malaria. Even fetus can suffer malaria in the womb.
Well, there's a lot of this or that, about the fetus part. But
Okay.
yes, a pregnant woman can suffer malaria. Most times, if the mother is sick, the child is uncomfortable and also not doing too great. But newborn babies, yes, can from as early as 2 weeks, 3 weeks, 4 weeks, can also come down with malaria, and that's why it's very important that you protect your child when you
The baby. Okay. So we know how babies can be very sensitive to, and it's not enough to just say yes, children suffer malaria. How do we even find out that the child has malaria? When you think your child has malaria, what do you do? What are some of the symptoms you should look out for, and what action are you expected to take? But before we go further to that, let's talk about malaria in the broad sense. Just give us a hint about malaria. I know that we've talked about malaria in past times, but let's talk about it a little and you can chip in how it relates to children.
Well, malaria is a medical condition that is caused when the female Anopheles mosquito bites you, comes in contact, and it transfers the malaria parasite to you. Yes. So when it comes to children, kids, as we know, kids cannot really fend for themselves. They can't really tend to themselves. As an adult, most times, if a mosquito is biting you or something crawling, you'll be like, what's that?
Exactly.
But children, most times, I would say their senses are not yet developed enough to even understand. Maybe some might cry out of discomfort, but they don't really know that they have to chase or protect
Of course,
themselves.
that
Yeah.
is.
So everyone, as long as you're exposed to mosquito bites, you can come down with malaria, regardless of your age.
Of your age. Thank you very much for Madam. So with children, what do you think are some of the symptoms? Because I'm forced to think that as adults have symptoms, children might have more peculiar symptoms to knowing that they have malaria. Like adults, of course, wouldn't cry when they have malaria, but children might just specifically start crying when
Yes,
something is
so
wrong.
for children, let's just say the younger ones who maybe might not be able to speak yet,
Of course.
you would notice more crying, crankiness, an increase in temperature. The
Okay.
body temperature will go up. Yes, you would also sometimes notice chills, like maybe you shivering and things like that. And when the baby might just be cry the whole day. So what's always recommended is that even when they can speak, they can't really tell you. They don't know what is wrong. They're just like, I'm not feeling well. I'm not feeling like myself, and or maybe if also tell you like, mommy, it's paining, like because malaria comes with joint pains. And
yes, it's true.
So the best thing to do, especially for pediatrics, would be to run tests. So it's always advised that you do your test, your confirmatory test, to be sure that my child has malaria, my child has this, because as I always tell people, malaria symptoms mimic several other things. Like a lot of medical conditions have similar symptoms as malaria, because we're looking at nausea, vomiting, fever, malaise, and cold. And when I say malaise, I'm talking about tiredness, weakness. So a lot of medical conditions mimic this pattern. So before you can confirm that this child is now with malaria, it's always important that you run confirmatory tests. So you need to see a pediatrician, go to the hospital,
and do what's needed. Thank you very much, Madama. I like the fact that you put the idea of visiting the hospital to see a pediatrician who would, of course, recommend that the child gets a test run and know the following medications to give, just to make sure that the child is in good.
Yes.
So what's next on our list? Now that we've known the symptoms, I like the fact that we're using the word symptoms. People mistaking symptoms to be once you see it, it exactly means. No, symptoms are signs. So when you say signs, it could mean that this thing could be this or this or this or that.
Yes.
Agree? It could be anything, but because it might be the most featured when it comes to a particular situation, we might say, okay, these are the symptoms that relate to.
Exactly. In that instance, it's a hypothesis.
Exactly.
Because we don't know what it is. We just know. And most times, as a pharmacist, I always tell parents, if you think that your child is acting up, or is sick, or is running a temperature, the first thing you should do go and start self-medicating and say, let me go to the pharmacy and buy malaria medicine. No. The thing you should do is you can start with giving a fever reducer. Like a paracetamol, yes, a paracetamol, Panadol, syrup, or even ibuprofen in case you just give
kids ibuprofen.
Yes. So just give a fever reducer to calm down the fever. What is causing the fever, on the other hand, you can never say. A pharmacist cannot tell you. You have to literally get to a hospital, run some tests, and be sure that you know what is causing the fever.
Exactly. Thank you very much, Madam. So now we've clearly discussed the symptoms. Let's talk about how to protect your children from malaria. This is the very important part, because if you can protect, there will be no need for you to start curing any situation. Like they say, prevention is better than cure, of course. So let's talk about preventions.
So for children, for pediatrics, some of the most common prevention would be to get a mosquito net. There are a couple of WHO treated mosquito nets that are being retailed around in some community pharmacies. You can get one of those. My favorite ones are those ones that you wear on the bed.
Exactly.
Like it has.
So
you just you climb into it like you're climbing into
it. But it happens that kids, I know my sister's kids, they don't like entering into the tent like that.
So for some people, I think some kids might have phobia for entering the tent.
They feel caged or something.
Yes, exactly. Some people just want to be sleeping and
just have the air and the freedom.
And some claim that it causes heat. I don't know, because I don't think I've used that in my adult years.
Okay.
So I can't really
tell.
Yes, but some people claim that I've had a patient come to the pharmacy and like, this mosquito net that you put on me, it's making me sweat.
Exactly.
And I'm like, auntie, did you put on the fan? She said, it's not about that. The phone is not penetrating through, so different people have different theories about it, but that's my number one. If you cannot do the bed tent, you can also use like the door nets.
Yes, door nets,
window nets, and just protect your children. It's very important. Secondly, it would also be not to, especially in this rainy season, not to leave the children outside later than 7 p.m. In fact, 10, but let's just say 7.
Especially in Lagos. Especially in Lagos. No, we will allow you to, but we have to tell you what you need to know.
But yes, you don't have to keep your kids outside for too long.
Yeah.
That will help. Thirdly, I would say another thing that will help would be to wear them like covered clothes,
Overalls
yes, or
and
the people
pajamas
maybe you can do the onesies and stuff like that. That will limit their body parts that will come in contact with mosquitoes. So those are a few things that would help
to prevent malaria.
Yes.
Yeah. Okay, that's great. So thank you very much. Now, we know that children have very sensitive skin.
Yes.
Do you think it is okay to use a preventive like the mosquito repellent that they put on skin for children? Is it safe?
Yes, it is. You know, there are some repellents that are specific for pediatrics, so it's safe. I don't want to call any branding, but there are some brands that are actually specific for children. But I would always say that it's the malaria cream. I don't want to call it malaria cream. The mosquito repellent
cream, yeah.
is not a treatment. You know,
No, of course it's not.
Yes,
Just like you
because
said, it's a preventive.
Yes, so a lot
treatment.
of people tend to use it, especially when maybe they live outside the country and they come into the country to Nigeria. They would like to get like an insect or mosquito repellent, so they put it on their children. Then if it's kids that maybe are going camping or going somewhere that you know that there will most likely be other kids, and kids obviously don't take 100% precaution when it comes to their skin.
Of course.
So you would also have to consider that as a parent. So that's what I'll say. It's safe, but most people tend to use it sparingly because as much as it's safe, it's not treatment. It's what's the word? I'm looking for the word.
It's still preventive.
Preventive. Well, yes, that was the word. But yeah, it's preventive. It's not treatment. So it cannot 100%. So once your child is down with malaria, there's nothing. If you like use all the mosquito repellent cream, there's nothing.
Protect the child from
further infections.
Yes, thank you very much for that. Okay, so we have this very nice bottle sitting on our table, and it's called Insonate 2120. Yes, Insonate 2120 oral suspension. It's powder for oral suspension. So, for Madam, maybe you should tell us a little about this pediatric anti-malaria that we have in our table.
Okay, so two things. One of the things I like about this anti-malaria is one, it's strawberry flavored. Like it literally tastes like ice cream. If this flavor is not all those my daughter, my son don't used to like. This one, the child will say, I'm not taking my daughter today. It's that tasty. And if you have kids, there are a couple of kids that also have phobias for like seeing bottles like this. You can always do one of all them. I see a lot of Instagram, always make shifts those of it in the case. You can put a straw maybe in a water, you can put a water bottle or something and put it in the mouth, or put a straw and make like a drinking out of a bottle.
Even without doing that, the cover it comes with is big enough. So might not exactly say, okay, they have phobia for even this cup like this. So how do they even know that it's in?
If you have a child, obviously you're giving the child like vitamin C daily.
So if one puts a straw to this, it will still be overt that is medicine.
The child will suspect,
it's small.
It's only a child who, how they say, they'll say, it's the person that something has not beaten before. And how they say, the person that snake has not beaten before, say snake is friendly. Yes, so you must have given the child something bitter. Or something that would trigger
that would have kept this memory.
Yes, so that's one of the things I love about it, the flavor. And also it's 100 ml, which means that it's 60 ml, and a pack is okay for a full dose. Because if you look at the dosing, you will see that it's from 5 kg to 14 kg. That's what the body weight is. So this is okay for a full dose, you just have to give 20 today, 20 tomorrow, 20 the next day. And also the dosing that you're going for depends on your child. It depends on the weight of the child, the age of the child. So if your child is between, let's just say 5 to 14 kg, yes, that is about 5 months to 8 years, to 3 years. The child will do 5 meal in the morning, 5 meal in the evening. Repeat this for a space of 3 days. But if your child is, sorry, if your child is anywhere from 15 to 24 kg, the child can do 10 meal. So you do 10, 10, 10, 10. So and that will be it. And you won't have any issue with malaria again.
Thank you so much for that. So one thing I would like to talk about, because of course I'm a medical practitioner and I can't exactly talk about the area you have just done now. But personally, I think I love all of Line's packaging.
Why
The brand, like this is so fine. You don't think
The
it's
amber bottle.
Yes,
Yeah,
it's really nice. I love the packaging, even the pack. Well, I want to go back to the cover. I like the way the cover is created because, of course, it has the right measurements. It's big enough,
Yes.
and for crying out loud, for an older child that won't be too scared of taking
You can
syrup, you can just use.
Even
this.
some people use the syringe like for, don't try this at home. If you have kids that are
You should tell them.
don't try this at home. You can try it, but just once. If you have kids that are big, you can get the syringe like
Okay.
5 ml.
Okay.
Okay, let's say your child is 5 ml. You get the syringe, take out the head or the needle part
Needle.
and fill the syringe because that's already 5 ml.
Okay.
And just even if the child is struggling, you just put it.
So it will enter without.
Obviously, the child probably gag in
Okay,
it,
and it will go down.
and obviously, some kids it only takes for them to taste it because when they taste it and they start okay,
It's nice. So they won't
we can
run.
have this one
Yes,
tomorrow.
they won't run
It's
away.
not even snacks.
That's
you
the
know,
good thing.
So
That's what's unique about Listening 2120. That strawberry flavor that would help you give your child the required dose as easy as possible. It can be very tasking giving children drugs.
I think if you build your method, if you find your footing, if you build a what's the word?
Let's use
If
strategy.
you build a
Let's use strategy. No, for these children, I think you really have to be strategic. My niece and nephews, if you see what they do to God, you just be like, their mother's managing.
yes, I was actually going to say.
Use it strategy.
I would say method. If you build a method, like you had a method to use in madness, like a method to take the job. I think you, as I said, the syringe was even someone that had seen.
I'm like, okay, oh wow.
There's women they use the syringe just to the child's mouth, like by the side, just working. And I'm like, by the time you touch it, like, this is bad. This one, some kids you may have to improvise, like you use maybe a pack of capsule or something to act as if, like
Obviously, it's the medicine
there was
that's
one
inside.
I saw on the internet. So this lady was talking about how she gets her kid to take whatever medication or drug without. So what she would do is she buy a pack of Ribena, give the child. She would drink Ribena here, and the child will say, no. I say, okay, hurry right up. She will take the pack of Ribena, it's sealed. She will cut it open. Put the drink inside. Put the straw. So the drink can be in the cup like this.
Okay.
You know those double-sized stickers?
Yeah.
She will take it. Pop. She will take
This
it
is
out.
this is somewhat criminal.
She not tell the child, oh yeah, come and have your Ribena.
Oh my God.
By the time you know what's happening, there's no Ribena that you're drinking. That drug is already
Already
down.
down.
So
Because he or she would have taken it down with force, with that confidence
Thinking,
that this is my
when you drink more Ribena. So at the end of the day, it's a case of.
This is so funny. I mean, this is the highest I've heard in
I
everything
saw
that you
that
shared right
thing.
now.
I thought it was genius level because this woman's
Wow.
child was drinking this thing. Oh, it's like now what he was doing.
Because his mindset is already programmed to the fact that it's
was
Ribena
like,
is
Mom? So it's a matter of
So
what's for
funny.
you and
Yeah.
yeah, so
Yeah,
that's
so Okay. So thank you so much for sharing all the tips. In fact, I hope some others are already on this show.
Oh, let me,
now.
yes, even sorry, cutting you short. Even to mention, I've seen adults who take the children's dose too.
Oh, wow.
Yes. So you know this pack is 2120.
Okay.
And the adult pack is 80.
8480. Yes.
So it's a derivative. Like this can give you that.
Okay.
So 80 is just times 4
Of this.
So that means that for people, for some adults, they will just buy more of this and take
Say like 2 bottles or 3.
Mostly, I'm taking this serum.
Just
That's
is it advisable?
well, it is. I would say it's advisable. It's not advisable. I'll just say if you're looking at it from a scientific aspect of it, by 2120 milligram, 8480 milligram, I think that it should be able to fly. I don't know about the other.
Should be 4 of this time.
I don't know about the other
maths, should be 4 of
implications.
this.
I don't know about the other implications, but a lot of adults do.
Oh, so what will now be
Because
the
they
consumption rate? About 4 times the recommended.
Yes, and they always say, a lot of adults always say, oh, I cannot swallow pill, I cannot hold down. You've seen, you've heard that, so they always go for. Yes.
That's no problem. We all have our choices in life in different areas, as you can sense us. So do what's best for you, but be sure that that best is good enough.
Yes.
Thank you so much for being with us. We hope that you're going to join us in our next episode. Always remember to click the subscribe button if you have not. And if you have, try to follow up with our shows, our programs.
Talk to us.
Of
Please
course.
talk to us. Engage with us.
Engage with us, yes, so that we can know how to help, where to help, and if it's something that we cannot give the best advice on, we'll definitely refer you to your doctor, hospital, and you do what is right. Okay, so thank you once again, and we hope to see you on our next episode of the Thursday Tea. This program was proudly brought to you by Lineage Pharmaceuticals Limited, and we hope to see you every other time.
Same time next week, same place. Don't touch that down.
Don't touch that down. Oh no, they should touch it down. We need to get coffee.
Okay, touch that down. Touch it.
Touch it down.
Oh my God. Touch it down.
Yes, we need.
Okay, so
the
before we
coffee.
go, let's cheers to a happy Thursday.
Okay.
Drinking tea to a healthy life and to be the
We
best.
didn't even talk about tea. Okay, yes, we did briefly.
To be
Cinnamon and apple.
the best version of ourselves.
Yes, thank you.
Healthy,
Cheers.
the best healthy version.